as you grow up and think about having children, you don't ever think that you'll end up with a sick child. So when I unfortunately went into hospital myself, I found out that I was pregnant. I was 4 weeks, which obviously was a shock. I wasn't expecting it. I was very excited. I went through the normal journey you go through for your scans, 12-week and the 20. Joshua was hiding quite a lot, so I had to go back 3 times for my 20-week scan. And I had my scans at not a specialised heart hospital, but the third person that scanned me noticed that something wasn't quite right. She wasn't quite sure what it was, but there was something wrong with the heart. I was taken to a separate room, and I was with my mother at the time, and the first thing that they discussed was termination, which, until I understood exactly what was the issue that was entering my head. So I was transferred to St George's, which are a specialised hospital for heart conditions, at which we obviously then found out what the condition was. It was one of the most complex heart conditions. So again, we were taken into a different room, and they went through the detail of what the condition involved, and if you were to continue with pregnancy, what the life would be like and what they would need to have done. And obviously they give you the stats about the potential loss of life and etc. And then later on in my journey, I had a needle put through to see whether they had any other conditions, and that was all clear. And then I met Joshua's surgeon, Mr. Guido Michelon, who is so pro-life, and just gave me the determination to proceed with my pregnancy. Thank you. So with Joshua's condition, he spent the majority of his life in hospital in the Brompton, and as a parent, luckily you get the opportunity to stay there with them. So Brompton becomes your home quite quickly, and you trust every single person there. You build real strong relationships with other families. So that moment of when you go home, it's met with very mixed emotion. We were very excited to take him home, but we were obviously quite concerned. The expertise and people who understood his condition were obviously at the Brompton. There were a few occasions that we had to take him to our local hospital, where it becomes very apparent that they aren't specialised. No fault of their own. They haven't been given the information, they haven't been trained in that aspect. The hospital isn't about that specialised care, but you can see that they are scared to make any intervention. So I would love to use the charity to try and prevent the uncertainty and the lack of confidence in dealing with babies with heart conditions. Obviously, being at the hospital, I know that numerous people have babies with heart conditions, and actually a number of them lived in my local area. So I don't want them to have to go through the same thing. So I'd like to try and use a charity to try and correct the lack of in the areas. As a parent, when you have a child with a heart condition and they're here for that period of time and you're in hospital, you do learn your child's condition inside out. I knew exactly what my son's stats should have been. I knew his medication, what it did, how much he had. It was imprinted. So to go to a local hospital and not be listened to, one, is frustrating. Two, it impacted on the outcome. And three, again, it's the lack of, and it's a respectful, not respect, but they need to understand that as a parent you know your child better than anyone. And you know the process, so you are told exactly what needs to happen if your child goes through any certain scenario. So if they go blue and floppy, you need to be doing this. So we know exactly what needs to be done, and to tell a professional medical person and then be ignored, and then to do that way too late is infuriating. So our initial target would be to purchase a portable echocardiogram, and this will really help because Brompton aren't only based at the Brompton, they have community hospitals that they work with, and this will just allow a far wider audience to be met. So people who live in further out areas from Brompton will then have the exposure to these services, and will obviously help better care for their babies and their children. That would be our initial purchase, and then obviously we then look at what is needed within the market to then potentially go on to purchase that. So when you first hear your child's got a heart condition, the first thing you obviously do, one, you're upset, you panic, but you go onto the internet and you try and research. Now, there's a vast amount of information on the internet, but it's about understanding where you need to go and the right information, because I think sometimes certain information can lead you to make a decision which is unnecessary, and I think if you have a whole package of the right information, you can then make a better choice. But it's about providing that support for parents and families. It's about providing information not only to the families and parents, but also to the medical staff. So we would like to build a platform that contains all the resources you need. So whether it's about a certain condition, or what hospitals provide, what equipment's needed, or for the medical side of it, we would like to do webinars that kind of explain what needs to be done for these babies and the things to be looking out for and the process that needs to be followed. So the first thing I noticed at the Brompton is how happy these babies are. It's like they really treasure life, and living in a hospital with sick children, you make huge bonds with fellow parents and families who are now lifelong friends to me. But Joshua made a huge impact on people. People often talk about him now. And I don't want anyone to experience what I had to go through. And I'd like to do everything in my power to try and help better the services that are available. The care that he received was incredible, and we're very lucky to have the NHS. But I would just like to help the little pockets that need more funding, better resources, but also from the people that I now know who've got kids with heart conditions. I want to do it for them and my son.
Yeah, Joshua unfortunately was born with a congenital heart condition, and during the very first few months of his life he had a couple of operations, but the medical care he had led him to have 10 different medications 3 times a day. And as he became more aware, I was absolutely inspired by him. Every time I saw him, he'd be laughing and joking, and he had a major impact on me, such that on the morning that he died, I realised why I was running my business, the Academy of Business Leaders and Entrepreneurs, known as ABLE. But I also then felt that it was the natural next action to take is to set up the Joshua Lynagh Foundation as a legacy to him, to help other young children overcome these conditions to have a longer and happier life. Well, there's a number of different aspects in terms of adding value to both the parents and all of the medical support staff, in terms of improved equipment, information. A number of the key elements was that unfortunately Joshua was at a hospital, not the Brompton, but at a hospital that was not aware of his condition, and they really lacked the confidence to be able to deal with him, and we unfortunately lost him. So we want to overcome that by offering improved equipment, but also equally important to give both medical staff as well as parents more and more information about how to deal with congenital heart conditions.
I always wanted to be a doctor since I was little, because I wanted to help children, I wanted to help, and then I decided to treat children with congenital heart disease. And I must say I find my job very fulfilling. Because when I do my outpatients clinic, then I can see that actually the babies who had such a hard time at the beginning of their life, the majority of them recovered, and they are growing and they are doing well. And that makes me really happy. Okay. And I was very honored and very humbled when Sophie approached me to be medical trustee of the Joshua Lynagh Foundation. Joshua was my patient, one of my first patients when I came to the Brompton. And there are gaps between the families and the professionals, and between the professionals in specialist center and between the professionals in community. And I think there are loads of ways how the Joshua Lynagh Foundation can be helpful. And with regard to the children and family, I think it is a very difficult time for the families when their children are born with complex congenital heart disease and they need loads of surgeries, and it might be very overwhelming. And I think to create a community or a platform where these patients and families can meet and share their experience, their concerns, their worries, it might be really helpful that these parents know that actually they are not on their own, that there are other families who are experiencing the same, and actually there might be light at the end, that the child might in the majority of the cases will recover and the life will be better and the children will grow. There is a gap between the community and between us, I think, which could be really somehow be fixed or at least made smaller, and in such a sense that it is also very hard for the community doctors to deal with children with complex congenital heart disease, because they don't meet them on a daily basis. They don't have the equipment. They might not have that experience. And it's very difficult for them, and they are scared. And therefore, I think communication with us would be very helpful. I think also some education and training days would be very helpful to where they can ask questions, where they will know who to call and how to get help if they need. I think that would really help the community professionals. In pediatric cardiology, echocardiographic machine is first-line method because it's non-invasive, it is portable, and it is crucial to see actually into the heart. We can get the morphology of the heart and we can get the function of the heart, and in amazing detail. So when we have a child with undiagnosed congenital heart disease, and we can assess this child clinically, and we can see that, well, there might be a murmur, or there might be shortness of breath, or the baby might be blue, but we don't know the diagnosis. And it is the echocardiographic machines which will help us to really get the anatomy and the hemodynamical assessment. And then we can take it from there, and we can then decide or see if the child needs medication, or if the child needs requires surgery or catheterization intervention, and that's crucial for the outcome and for the life of the children.
I got involved because Peter's been a very good friend of mine for many years, and it was his grandson who passed away, and I have lots of board experience, so when he asked for people to volunteer, it was important that I could reach out and help him. So that was one of my main reasons. And the second thing is, as a mother, I can't think of anything worse than losing a child, and that really resonated with me, and that was the reasons that I chose to become a trustee of JLF. I think the charity's overall purpose is to empower, educate and support. There is so much to be done in this area with children that have these conditions. We need to help the medics to diagnose quicker. Often parents are left, unsure of where to turn, the support they're looking for, and we need to give both these groups of people all the information and the help and support that they need to help them get through something which can be horrific for any parent to have to go through. So that's fundamentally what the JLF Foundation stands for. There are so many children that are born with heart defects in the UK. These children often die needlessly due to not having access to the relevant equipment, to maybe medics in local hospitals not having the confidence or the experience to be able to diagnose quickly. And the JLF Foundation is for that reason. Joshua did not need to die. He had every reason to live, but these were some of the impacts that his poor mother had to go through. And I think if you're in that situation, it's the right thing to do to donate so that we can actually save more lives and save so many parents from being bereft and heartbroken from losing a child.
I've been good friends with Peter, Joshua's grandfather, for many years, and was very familiar with the story of Joshua's birth, the complications he had, the way that Joshua joyfully embraced life. Peter would tell me those stories, and I had my own personal connection beyond that, which is my own eldest child was born and there were complications with him, and he ended up in an intensive care unit for 11 days. And we were very blessed that we were able to take him home, and he developed very normally after that. And whilst that was going on, every day in those 11 days I was visiting him in the ICU, and either side of my son there were 2 other sickly children, and one of the children, whose name was Emma, I got to be quite good friends with her parents, particularly her father, who used to be up there at the same time as me, and he would be taking pictures of his daughter, and we would be talking about our respective children's issues. One of his children, one of the issues that Emma had was that she had a heart complication, but she did have other issues as well. And I remember about the 9th day that Joseph was in intensive care, I went up there as I usually did to visit him, and there was not 1 but 2 empty spaces either side. Either side of Joseph. No parent should have to go through that. My heart went out to the parents of Emma when I realised what had happened, when I asked the nurse where the other children were, and she told me they didn't make it. That's why I'm here. Please support us and help change this reality for some people. Thank you.